Okay, for an application of a TENS unit, or to explain to the patient what it is, because sometimes we do have prescriptions from physicians that, recommend a patient use a TENS unit. And then there's sometimes when the therapist thinks that that may be an appropriate tool as far as use at home. But basically what a TENS unit does is it blocks the pain receptors that signal to the brain that, okay, this feels pain. So, for example, you have an arthritic knee that has a lot of pain sensation. You can put the TENS unit on there, and it uses electricity. It sends the impulses around the knee where the pads are placed, and it has like that tingling type sensation. So basically it's blocking the painful sensation to the brain and instead replacing it with that tingling sensation. So I like to relate it to patients where, let's say you put your hand on a hot stove. Well, it obviously hurts a lot. You start rubbing your hand back and forth, and that you have that friction kind of sensation because it hurts so bad. And so instead of your brain feeling all of those pain receptors, you're now feeling that vibration and friction technique from you rubbing your hand to try to alleviate the pain. So the pain is still there, you're just kind of blocking it and covering it up with something else. So in the same regards, that's what a TENS unit does. So we don't like to use it a lot during treatment just because it's a cover-up, it's kind of a band-aid, it's not a fix. But if a patient is, wanting to have one for home, that's totally appropriate. And they can, take one at home, take one, we'll show them how to use it, they can bring it home, they can use it as many times as they would like to throughout the day. If it makes them more functional, then that's usually what I think is an appropriate area to kind of say, okay, here's what you should do. You have so much pain in your knee that you can't walk far enough to be able to go grocery shopping, which is something vital that they need to do, or they live alone and they need to be able to bend down to feed their cat. So if they can put the TENS unit on at that point, go grocery shopping, be able to get through the entire functional activity, and then take it off once they're done. So in the clinic, we typically don't use it very much because it's more generally prescribed for patients that have that chronic pain that's limiting them functionally.